Basically what we're looking at now is if we did planar motion testing and the patient didn't have a significant restriction, we could do combined motion testing. Also, if the patient falls into that kind of hypermobile category, they're a self-manipulator, they feel pain or clicking with rotation, etc., this is a test that we could use. So with normal flexion and extension, side bending, rotation, if you have somebody who has a joint that's not maintaining its neutral zone, sometimes it'll look like they have good mobility and sometimes it'll look like they don't. So what we can do is we can do a figure of 8 testing, which is essentially scribing 8s in all the quadrants, looking to see if there's any clicking, looking to see if there's any abnormal motions or blocks. So what we can do is we can start in neutral. We can flex through the full range, side bend, come back to neutral. Then we can side bend, extend, and flex back to neutral. So we've done this quadrant, started in flexion, ended in side bending in the other quadrant. Then we go flexion, side bend, and back, side bend, extension, and back. So we're doing this basically for the cervical spine. If we felt there was some clicking or we felt we could isolate it to a segment, you can always fix that segment. So if we felt that, you know what, there was something funny going on at C5, C6, you can fix C6 and do the same thing. Flex, side bend, come back to neutral, side bend, extend, back to neutral. Flex, side bend, back to neutral, side bend, extend, back to neutral. You also might find in one of those combined motions a block. So let's say you go flexion and then you go into side bending and you're like, wow, that feels like he's hitting a solid barrier there. Well, then what we would do is side bend and flex and see if we're hitting that same solid barrier, just like we did with H&I testing, just for confirmation purposes. So then if somebody has a consistent block or a consistent click in a certain quadrant, one, we want to relate that to what are they doing functionally, because then they have to be aware of it. If they're sitting at a desk and they're flexed and in this position all the time, okay, well, we've got to look at shoulder position, etc., in order to address that. And then secondly, if it's a consistent block, when we do our mobilizations, we come back to that functional quadrant for our testing and retesting purposes. So there's multiple uses for that. Good. So that is figure 8 testing.